Good morning, Lorraine. How you doing today?
I'm doing fine, thank you, Joanne.
Great. I was wondering how things have been going for you lately.
Things have been going well. I've been adhering to my medication and eating right.
Okay, well, good, because that's what we're going to talk about today, medication adherence. As you know, we rely on medication to treat diseases and conditions to prevent hospitalizations and improve quality of life. Medication adherence is an important part of diabetes self-management. So, can you tell me a little bit about what you think self-management is?
Well, it's taking your medication, knowing when to take it, eating correctly, like I mentioned before.
Okay, and you're absolutely right. However, many patients do not take their medication like they're supposed to. So that's the reason the Adherence project is a part of what we're doing with you to help people self-manage their diabetes, to make sure that they're taking their medication properly, they're taking it on time, and those things of that nature. Um, when can you tell me if you have been experiencing any problems with your medication?
No, I don't experience any problems. However, it was lowered from my last doctor's visit from 1,000 milligrams twice a day to 500 milligrams twice a day because I lost weight.
Okay, and that's good.
Yeah,
Yeah, so how are you feeling?
I feel better.
Oh, okay. So, what were some of the things that you did to lose weight?
I was very careful with. I'm very careful with my portion control, and I eat about what I want. It's just that I'm very careful with my portions.
Okay, so I don't know if you remember when I sent the portion plate out to you. So, are you using that to measure your foods?
Not always, because I pretty much did that already before.
Okay.
Yeah,
Yeah, I just thought that would be an added plus to
it was
you.
nice.
Oh,
I
great.
enjoyed getting it.
Okay, so now I want to talk about medication non-adherence. I want to be sure that you understand what medication non-adherence is. So, can you share with me what you think medication non-adherence is?
It would mean not taking your medication on time, not taking it at all, or taking too much, not getting your prescription filled, not going to the doctor to get a prescription.
And you're absolutely right. And that makes you such a wonderful student. I enjoy working with you so much, Lorraine, because you're good when it comes to change. You know the importance and what you have to do as far as maintaining your diabetes. So when it's all you have to do is just introduce you to it, and you just run with it. So I want to thank you, for doing that. Also, I want to talk about barriers today. So at this time, do you have any barriers going?
Well, one barrier would be my transportation
Okay.
difficulty. I have a friend who can take me most times when I have an appointment to get to.
Okay. The last time we talked, you had a concern about scheduling. You said that you were having problems making your next appointment or getting through. So do you want to share that with me?
Well, I was trying to get through to the clinic that I attend, but they would never return my phone call, and it always switched over to an answering machine. So I was never able to reach them, so I couldn't make an appointment to go back to them.
And the thing about it is, it's not. I don't think it was something that was intentional. I do understand that there's a new phone system that's being put in place, so I think they're just working the kinks out. So, but that would be a barrier for you. Another barrier that I would say is having the funds to pick up your medicine. So, have you ever experienced that?
No, I've been able to get it because I'm on a pretty good program where I can afford it.
Oh, that's great. And sometimes the number of doses could be a barrier for some people. So sometimes they experience problems. And you said at this point you haven't experienced that.
No, I just take it twice a day, once in the morning and once in the evening with my meal.
Yeah, because some of the other patients that I've dealt with, is that I guess the medication might have been a little bit too strong, so the doctor had to, lower the dosage. So those are barriers. I just want to make sure, and even depression can be a barrier. So, you know, scheduling appointments, side effects, and sometimes people just simply forget to take their medication. That could be a barrier also.
Yes.
So I just wanted to make sure that you know what the barriers was, what medication adherence was, medication non-adherence. Now I have just a couple of questions that I want to ask you about the project, and I sort of jotted them down so I won't forget anything. Can you tell me, what you think about the project, what you like about the project, this far?
Well, I liked it because it kept me attuned to what I needed to be doing. It kept me up to date. Always having those checks in place was very helpful.
Okay. Also, I have another question. Is there anything you would change about the project?
No, I can't think of anything.
Can't think of anything. That sounds good. Do you enjoy having your own personal community health worker, which would be me?
Yes, I do, very much.
Okay.
Because you're aware of me. I don't have to get to know you all over again. You stayed with me throughout the whole program.
Okay. Is there anything else you would like to say about the project before I, go in and call you back on next month?
I think I would like to say that you've been very excellent in your manner. You're very thorough. You've done a really good job. You're very personable. I knew you had an actual interest in me, not just as someone in a program, but that you really cared.
Well, I certainly thank you for that, and I have 5 questions, and you are so well aware of these questions. I asked them to you at each session when we close, when we are scheduling for the next month. Do you ever forget to take your medication?
No.
Okay, are you careless at times about taking your medicine?
No.
When you feel better, do you stop taking your medicine?
No.
Okay, when you feel worse, do you stop taking it?
No.
Do you ever run out of your medication?
No, I don't.
You're such a good student, Lorraine. All right, well, I hope you enjoy the rest of your week, and you have a great day, and I'll talk to you on next month.
Okay.
Thank you so much.
You're welcome.